So I was wondering if you could just introduce yourself and tell us about the work you've been doing.
My name is Mai Linh-Hong. My day job is I'm an assistant professor of literature at the University of California at Merced. I've been working with a group called the Auntie Sewing Squad, which is led mostly by women of color and specifically mostly Asian American women. It was started by the comedian and performance artist Christina Wong, who's based in Los Angeles. So a lot of the group members are in California, but it is a national network at this point. So we probably have about 800 or 900 members, but maybe a third to half of whom are really active in the mask making operation. But since fairly early on, the squad has been serving vulnerable communities that are not necessarily healthcare workers and that have been hard hit and basically abandoned by the government. So we've been able to direct masks to asylum seekers, incarcerated people, Native Americans on reservations, just a lot of communities like farm workers that just don't have access at all. So the group has made probably close to 100,000 masks. It's a big operation. There's a complicated supply chain. There's a lot of spreadsheet. People who are involved in different aspects of the work, including coordination and logistics. And one of the things we're proud of is we have a whole care aspect. So we have aunties whose sole job it is to provide sort of self-care packages for people who are working. And a lot of this is, those of us who either were sidelined from our jobs. So there are actually a lot of artists, performers and folks who basically lost their jobs. And so they have the time, but also folks who have been working from home. And we have all essentially turned our houses into like little sweatshops. We are not shy about using that expression, sweatshop. There's been some discussion about it, but it's hard work. And it's also speaking to a history of racialized labor. We are women of color. Many of us do have connections to a garment industry that regularly exploits the labor of women of color. We are doing this work for free because the government has abandoned communities of color in the United States. We should not be doing this, and it's taking a toll on us physically, emotionally, and financially, but it's work that we feel needs to be done. So that's kind of where we are. It's just gotten a lot of media attention over the last couple months. We have a book project in the works, actually, that's going to come out in the fall of 2021, so next fall, from the University of California Press.
Can you maybe tell me about sort of the needs that were initially seen that made people respond?
I joined the group in probably late April, early May. But Christina, when she began the group, it really was like a lot of us were working individually and had very similar stories. So essentially end of March or so, it became clear that masking was going to be an important piece of the public health response. The CDC had not yet admitted that, but I think a lot of us knew. And so folks who were able to sew, some of us were beginning to do that. For me, I started making masks and I put out a box on my porch, starting at the beginning of April, just that people could just walk by and grab masks. So I've given away hundreds of masks that way. Christina put out a call on Facebook, like, if you're a friend of mine and an essential worker and you need a mask, tell me, I'll send you one. I'm not a great sewer, but like all of us have the exact same story. Like, I'm not an expert at this, but if you need one, I'll help you. And then she was overwhelmed with requests, and that happened to all of us. So we, started to organize. And I will say, there's tons of these like masked groups like on Facebook and such. I was part of two other ones that I quit essentially for climate and political reasons. They tend to be older white women who are doing it for patriotic reasons. So I quit those groups, and when I became a member of the Sewing Squad, it's a group whose politics and whose culture aligns with the way I view the situation. We have become a pretty tight-knit group.
It sounds like an immense logistical challenge, both for you alone, but also for the entire network. Like, can you tell me about some of those challenges that you've confronted?
The communities that are receiving the masks are not easy to connect with. So we have to vet the organizations that we work through. So these are nonprofits or individuals in some cases, but we have to very carefully vet those who are needing and requesting masks to make sure that they have the means to distribute them and that they truly understand their need. So they know who they're serving and what sizes they need. It's very easy to like get requests from all over the place and then think, oh my God, this hospital needs like 9,000 masks, but that hospital has reached out to like 50 groups. We have super aunties who do the coordination of the big requests. They keep massive spreadsheets. They'll post a request on the Facebook, on the working group, saying like, okay, we need 2,000 masks that are serving farm workers in the Central Valley of California. There's wildfires. We're also sending N95s. They'll give all the information, and then aunties will pledge. They'll say like, we need these within 2 weeks. And then the aunties will pledge, I can do 50, I'll do 50 adults, 50 kids. So there's a long string of the pledges, and the auntie who's coordinating that will keep track of all the pledges. And then when you're finished making your masks and you're ready for an address, and you message them and they'll give you an address. And there could be a lot of different addresses for a single request, because they're often like combining requests and then coordinating to make sure that everyone gets what they need. That's basically like the structure of it. But as you can imagine, there's a whole crew of super aunties who are doing the coordination, doing the groundwork. We got masks into San Quentin. This is not easy. San Quentin, as well as a large women's prison in California. It is not easy to donate anything to a prison because they do not want anything coming through the door. But we managed to do it, and got like thousands of masks into prisons where there were really bad outbreaks going on. We've also sent relief vans to the Navajo Nation, which the Navajo Nation has been particularly just really, really badly hit. And statistics are not even, you can't even trust any of the numbers that are coming out, because the rates are far higher and the death rates are really devastating. There have been, I think, 4 relief trips to send sewing equipment. We bought sewing machines, sergers, sent fabric, also sent all kinds of medical supplies. It is disgusting to me that we are sending medical supplies, because this should not be an issue. But they have an Amazon wish list. You can send cots, you can send adapters for a ventilator, whatever, like real medical stuff. It's insane. So anyway, we're just trying to keep up and provide as much as we can.
Where do you see this work? Where do you see it going? What do you hope to see in the future? Do you think this work ought to continue?
No, we should not be necessary. We should be obsolete tomorrow. We should be obsolete 3 months ago. Christina is always saying the goal of this group is to become obsolete. And we get these ridiculous, ideas from people who are like, have you considered selling your masks to make money for what? And we're like, no, we're not a business, or have you considered becoming a nonprofit organization? No, we're not meant to be around. We don't want tax exempt status. We want the government to do what they're supposed to do. So that's the basic answer, is we don't want to exist.
Do you see hope for that?
I do think some things will change if the election goes the way it should in November, but I don't fully trust that we're going to have an election in November at this point. And I live in a very heavily Trump supporting area. These are the folks who elected Trump, and this is the part of the state that did it. So there's Trump signs everywhere. A significant portion of the country is seriously deluded. We are not working on the same set of facts at all. But if somehow we manage to get through the election and have a peaceful regime change, I do think that there are functioning people who work in the government as career employees who can make the coordination happen. There are experts who will step up, and if they're given the opportunity, because they've done all the planning. Of course the government has done all the planning. They have the stockpiles, they have the legal tools they need, they have everything they need. They're just not freaking doing it. I think if we have the right leadership, then all of these folks can step up and do the job that they're trained to do. And we can get the equipment to everyone who needs it. We can get the testing out. We can get the vaccine out. When the vaccine is ready, it can be distributed fairly and quickly. And that's the goal.
Has there been a local response to the work you're doing? Have you talked to people around you about what you're doing? Have they said anything?
Because we're in a little college town, we do have a little academic bubble around the college. My immediate community, it's the town of 6,000 people. So I knew that if I was gonna sew hundreds of masks, that could actually have an impact. Neighbors have been super supportive. I've gotten money and cards and notes, and I've been keeping most of them. It's lovely. I mean, it really kept me going. And people are funny too. For a while there, I was coming out multiple times a day to all kinds of stuff. People were leaving me flowers. Someone left me a huge box of lace And it looks like, maybe their grandmother had died and like left this huge, like thousands of yards of lace. And I ran out of elastic at one point, started using it for mask ties. Someone left toilet paper once. We were like couldn't find toilet paper anywhere. And I got a roll of toilet paper in my mask box. So those kinds of gestures are wonderful. I think there's definitely like a strong supportive contingent in the community.
Well, Maylene, thanks so much for sharing your story with us.
Sure.